Hi, I'm Tyler Tremere, CAP's CEO. I'm here to share with you an important update from all of us at CAP. First, I'd like to acknowledge that we are living in an unsettling and confusing time. We hope that you are taking good care of yourself, physically and emotionally, so that your loved ones and community can stay healthy and safe. Since the COVID-19 public health crisis began, CAP has been following the guidance of public health officials on how to best serve and protect our communities. That balance between serving and protecting has been hard, especially as a public health and social service organization. We recognize that the populations we serve are often the most vulnerable during a public health crisis, and many of them come with past trauma around dignity of care. Very recently, there have been new and more serious guidelines put in place from public health officials on how to contain the spread of COVID-19. These guidelines include restrictions on gatherings of 10 people or more and place emphasis on social distancing. At this point, it is unknown when those restrictions will be lifted. Because of the urgency in curbing the spread of COVID-19, I have made the extremely difficult decision to suspend on-site services at all CAP social site locations in Northwest Portland, as well as in Vancouver and Longview, Washington. An update on the timing of reopening these services will be provided on or before April 10th. Until then, CAP staff are working remotely and are available by phone or email during regular business hours. They will be working with our clients to continue delivering essential services in an adjusted capacity. We will be putting together a volunteer crew to remain at CAP offices for emergency needs and to serve those who don't have access to a phone or email, as well as be there to assist those in critical need of access to food and medication. Our on-site services at Prism Health remain open at this time, but we are swiftly working to roll out telehealth for our primary care and behavioral health services to protect the health and safety of both our patients and our staff. We have also made the difficult decision to move our largest fundraiser event, the CAP Art Auction and After Party, from April 25th to July 11th. I want to assure you that I have not made this decision lightly and have made it in consultation with our public health authority, my colleagues around the nation, and our state and local community partners. This will be the first time in CAP's history that we have had to suspend on-site services to our community. We are in uncharted territory together. On a personal note, this is one of the hardest decisions of my professional career. Do you remember decades ago, in the early days of an epidemic, when we didn't know much about a new disease that was impacting our community, and day by day we were learning how it spread? When people panicked and fear dominated, when our government didn't care or have a plan, when most people wouldn't interact with those that were sick or touch them or provide them the compassionate care and services that we as humans deserve. I wasn't there, but I know the pain and truth in those stories. They are the birth of the very organization I am proud to work for and lead every day as a person living with this disease. This is truly breaking my heart. I know that this decision means that for some of the most vulnerable people we serve, we will feel out of reach. that some of our clients will experience an increased sense of isolation and fear, and some will fall through the cracks and out of care. I also want to acknowledge that our community of long-term HIV survivors often suffer from post-traumatic stress disorder, and that trauma is cumulative. The reality is that fear of the unknown during this time is triggering. These feelings are valid. As a Black gay man living with HIV for 16 years, and the CEO of this organization, I am here to offer the reassurance that the very best of humanity that we witnessed in the 1980s is still here within us. And CAP is being called upon once again to demonstrate it. That is why CAP and Prism Health exist, and why we approach our work through a trauma-informed and client-centered lens, even in times of crisis, emergency, or uncertainty. This is extremely hard, but I have faith that we will get through this because of you. We need now more than ever to have you on our side. In these challenging times, we have to do everything we can to make sure that our communities aren't devastated by COVID-19 and that we make it through this period financially stable. Now, I have to be honest. I am concerned that CAP will not have the financial resources needed to provide critical support and healthcare to our vulnerable populations. During public health emergencies like the one we are currently facing, it is not uncommon for government resources, like the ones who fund our organization, to be reallocated to the response. Additionally, we anticipate that because of the economic instability surrounding this crisis, our private donations will decline drastically. It has the potential to create a major economic crisis for CAP. And that's why we need you. Please consider making a first-time donation today, or double down on your annual donation to CAP so that we have the financial resources necessary to do our mission-critical work in 2020 and beyond. We know that this is a lot to ask in a time of uncertainty, but CAP's services and future depend on it. In closing, I assure you that we are working around the clock to monitor the situation, make informed decisions to care for the community we serve and for one another, and to come out stronger on the other side. I'm trying hard to get this right for our community and for all of you. All I can ask is for your continued patience, partnership, and support as we navigate this rapidly changing landscape. Most importantly, remember, we are in this together. The HIV community knows better than anyone how to respond to an epidemic with organized compassion, collective action, and grace. We know how to take care of each other, and we will do that by creating systems to support each other, to check in, and by continuing to support those we serve who are often sick, hungry, in crisis, and isolation. We must prepare, but not panic. We are here for them. We are here for you, and I hope that you will continue to be here for us. Thank you. Be bold, be well, and we'll see you soon.